Welcome back, medical coders. We are looking at another primary care visit with a chart. So let's get to the chart here. Okay, so we are looking at a chart for Olive Oil, female, date of birth October 1065, 58 years old. Visit to Dr. Marcus Turner on November 13th, 23 at 10:15 a.m. And Olive Oil is presenting for routine follow-up to manage chronic medical conditions. And she reports stable symptoms related to osteoarthritis, hypertension, and gastroesophageal reflux disease, or GERD. She reports no significant changes or exacerbations noted since the last visit. And we have a review of systems. Everything is pretty much negative, except for some mild joint pain due to the arthritis and occasional heartburn managed with over-the-counter antacids. Okay. We have our medications here: naproxen, amlodipine, and omeprazole, and dosages. No known drug allergies. Regular exercise, low impact activities, non-smoker, social alcohol. No significant changes in family medical history since the last visit. And we go to the physical exam. We've got some, she looks well nourished, no acute distress. Vital signs look pretty decent here. Musculoskeletal, mild tenderness in joints, and no abdominal tenderness or masses. The assessment is osteoarthritis, which is stable, hypertension, which is well controlled, and GERD, which is well managed. And the plan is to continue current medications, adjust pain management for osteoarthritis as needed, schedule follow-up in 6 months, and patient education was provided on joint protection techniques for osteoarthritis, general patient education on the importance of joint protection, lifestyle modifications, and medication adherence for optimal management of her osteoarthritis. Again, patient was instructed to schedule follow-up appointment if any changes in symptoms or concerns arise. And this is signed by Dr. Marcus Turner, I apologize. So let's take a look at the coding for this encounter. So we have M1990, we have I10, and we have K21.9. Okay. And we are reaching a office visit of 99214. And we have the diagnosis pointer for all 3 diagnoses that are documented in the record. And that is A, B, and C from the box 21 for the diagnoses. And in column E, the diagnosis pointer correctly points to those diagnoses. So let's take a look at how we would code this record. So we do have 2 or more stable chronic illnesses: osteoarthritis, hypertension, and GERD. All 3 are chronic, so we certainly have more than enough. We don't reach high, so we got moderate in the number of diagnoses. No labs were reviewed or ordered or anything like that, so we have nothing in the amount and complexity of data to be reviewed. But over at the risk table, we do have prescription drug management with continue current medication regimen. Now, I do want to point out that there is here I'm sorry. No, I'm sorry. So I was thinking of another record, so just strike that. So we have prescription drug management, which reaches moderate. We have 2 or more stable chronic illnesses, which reach moderate. We need 2 out of the 3 for an established patient, and so we will reach a 99214 for this visit. So this is pretty straightforward. Pretty straightforward. Um, uh, Leveling of the E&M code, and everything is looking pretty good there. So now let's take a look at the risk adjustment HCCs. Okay, and so hypertension, okay, does not risk adjust for an HCC. However, it does risk adjust for an RX-HCC. And the GERD also does not risk adjust for an HCC. And in the VO5 model for RX-HCC, it does risk adjust. In the VO8, it does not. Now, I've mentioned before, this is not a program specifically designed to teach the full risk adjustment methodology. We do have a program if you are interested in and learning, the full details of risk adjustment, which I do highly recommend. But over the time that Medicare has had risk adjustment, which is 20 years, you see the V's, the V21, V22, V24, V28, VO5, VO8, and there's others. These are versions, and the methodology has evolved over time and will continue to evolve over time. So these are different versions, and so the GERD that did risk adjust in VO5 does not risk adjust in VO8. Sometimes you'll have conditions that didn't risk adjust that are entered into the model, and just will suffice it to say that for now. That it's a just like you have CPT changes every year, just like you have ICD-10 changes every year. The risk adjustment model also evolves and changes periodically. So this is a pretty straightforward record, and so we will just remind you in regards to diagnosis coding that adherence to guidelines is required under federal law. So we certainly do seek to help you, master your diagnosis coding as well as any other codes involved in these encounters. Remember to code all documented conditions that coexist at the time of the encounter or visit with clinical support. And so that is the second PCP record, and we will see you in the next encounter.